They say, hey, what are the symptoms or how do I know I have advanced gum disease? Or periodontitis is the fancy word that we use in the medical community. One is, again, you have swollen puffy gums. They can be really bright red, more purplish in color. When you touch them, they'll be really tender, almost hurt, and actually can actually bleed a lot more easily. So when you brush your teeth, you may take your toothbrush out, and the toothbrush head may be more pink in color, or if you spit out, it'd be a little more blood in your but the toothpaste mixed in there. That's a really good telltale sign you have more of advanced gum disease. Bad breath, that's just constant. You brush your teeth, and then just like 10 minutes later, it still stinks. Um, you may see pus in between your actual teeth and gums where it kind of oozes out, like almost like a pimple. That's when you have a really severe infection. The teeth may be loose. They may start to spread a little bit and flare out, and they have more spaces than you actually noticed from before. Chewing on the teeth may actually hurt. It's uncomfortable. Don't really want to chew. May favor to one side, and the gums are not tight like a collar. They get sort of pulled away, right? They're pulled away from the actual tooth. And then lastly, too, is that when you actually put your teeth together, they just don't feel like they used to feel. So all those different things could be all symptoms. If you have any of those, one, two, three, come see me. Go see a dentist because we want to make sure we do the right type of gum therapy for you. There's 8 different types, so that's how you definitely know, or most likely know, that you do have more advanced gum disease or periodontitis.